Let's talk about a really surprising finding in cardiac arrest treatment.
You know, when the heart stops, the response has to be fast and aggressive.
And that usually means repeated doses of epinephrine to try and jumpstart the heart.
But what if, for some people, less of that drug is actually more effective?
So researchers compared the standard multi-dose protocol to a new single-dose idea.
They looked at how these two approaches worked across different age groups.
For young and middle-aged folks, there wasn't really a difference. Pretty similar outcomes.
But for patients 65 and older, that's where things got really interesting.
The single-dose protocol was linked to way higher survival to hospital discharge.
In fact, we're talking about nearly doubling the odds of survival for this group. That translated to a 5.6% absolute increase in survival, a really meaningful number.
So you'd think the single dose was just better at restarting the heart, right? Nope. Surprisingly, the exact opposite was true. Here's where it gets weird.
ROSC, that's just the medical term for getting the heart to beat on its own again.
And look, the single dose was actually less successful at getting that initial restart.
So, to be clear, better survival despite being worse at initially restarting the heart.
But wait, before we change everything, we have to look at how this study was done.
This was an observational study. That means it can show a connection, but not prove cause and effect.
And these limitations mean we can't be 100% sure about the results. Yet.
To be fair, the study did use really strong statistical methods to adjust for things.
So, where does that leave us? What's the big takeaway from all this?
Well, the study is considered hypothesis generating. It raises a huge new question.
So it's not a new rule, but it's a huge reason to do more research. And that next step? A randomized controlled trial to get a definitive answer.
It leaves us with a really provocative question. For older patients, could less truly mean more?